UNFPA is the United Nations Sexual and Reproductive Health Agency supporting reproductive health care for women and youth. The health of pregnant women, especially the ones who face life-threatening complications each month. It also works to give reliable access to modern contraceptives, the training of health workers to help ensure that at least 90% of all childbirths are supervised by skilled attendants, prevention of gender-based violence, abandonment of female genital mutilation, which harms so many girls annually, prevention of teen pregnancies. This UN specialized agency also makes efforts aimed at ending child marriage, which could affect an estimated 70 million girls over the next 5 years, delivery of safe birth supplies, dignity kits and other life-saving materials to survivors of conflict and natural disaster, and censuses, data collection and analysis, which are essential for development planning. UNFPA's maiden activity in Liberia was the establishment of the Demographic Unit, presently the Institute for Population Studies at the University of Liberia in 1973. As part of this initiative, several Liberians were supported by UNFPA to acquire postgraduate diplomas and degrees in population studies. Some of these individuals have been training new corps of demographers and statisticians at the University of Liberia.
So we have trained a lot of us Liberians who are now in different areas. So I think they have done a lot for Liberia in terms of support.
Since my return, I've been able to also provide teaching and research in population sciences and development in the country.
In addition to capacity building for data collection and analysis, UNFPA has been leading the UN and other partners' technical and financial support to Liberia for the conduct of demographic and health service and national population and housing censuses.
It was the United Nations Population Fund that made us to start activities at Lagos. They provided desks, chairs, computers, other things because they really wanted a statistics office to work with. So they really put in more resources to have Lagos where it is today.
Guided by the program of action adopted by 179 governments at the International Conference on Population and Development ICPD in Cairo, Egypt in 1994, UNFPA works in Liberia to ensure an improved reproductive health sector, which includes reduction of maternal mortality, unmet family planning need, and HIV prevalence by supporting the country's capacity to implement a comprehensive midwifery program, provision of quality emergency obstetric and newborn care services, as well as the prevention, treatment, and social reintegration of survivors of obstetric fistula.
Fistula is an issue in Liberia, and with support, both technical and financial support from UNFPA, we are being able to provide quality services to our survivors, not only medical or surgical, but even rehabilitation services, that when they go back to the communities, they are being able to be independent because we know that fistula comes with a lot of stigma and people will not want you to easily accept you in the community.
UNFPA supports Liberia to guarantee an increased access to and utilization of quality family planning by ensuring the availability of a wide range of modern contraceptives and services to all throughout the country. These services help ensure wanted, healthy pregnancies and safe births. Yet, far too many women lack access to these services. This is why UNFPA strongly supports the training and work of midwives in Liberia through midwifery schools and training institutions and the strengthening of national midwifery associations to help enhance the regulatory framework for midwifery practice to ensure accountability.
Most of us who have graduated, we are still in the field. We still have more than 75% of us still in clinical midwifery. The remaining 25%, they are instructors at the various midwifery institution. So we are still contributing immensely to the work of midwifery in Liberia.
The integration of HIV and sexual and reproductive health, including sexually transmitted infection prevention, STI services, into all reproductive health interventions and support for an increased access to quality HIV and STI prevention services. During the outbreak of the Ebola virus disease in Liberia between 2014 and 2015, UNFPA buttressed the Ministry of Health's effort to conduct systemic contact tracing and surveillance of individuals who might have come in contact with suspected Ebola-infected persons, supply personal protective equipment including gloves to ensure that pregnant women are attended to by skilled birth attendants during delivery without fear of contamination. UNFPA, cognizant of Liberia's growing youthful population, is investing in concrete programs with its partners through adolescent sexual reproductive health and youth-friendly services to meet young people's needs for health care, sexuality education, and economic opportunity by empowering Liberian youth who are at risk of unwanted pregnancy, HIV/AIDS, and other sexually transmitted infections, as well as sexual exploitation, to make sound decisions, including delaying sexual activity and avoiding risky sexual behavior to meet the country's demographic dividend. Gender-based violence and harmful practices, including female genital mutilation, FGM, remain prevalent. UNFPA has been involved with efforts to strengthen the legal policy and implementation framework to support the advancement of gender equality and empowerment of women and girls in Liberia, to include the formulation of the National Gender Policy and a GBV Action Plan, the establishment of GBV Division at the Ministry of Gender since 2008, and the passage of the Rape Law. UNFPA also supports the provision of medical, psychosocial, and protection support for SGBV survivors at one-stop centers and safe homes, as well as psychosocial and social coping support for alleged perpetrators of sexual violence on pre-trial detention. In 2008, UNFPA also led efforts by the UN for the establishment of Criminal Code E at the Temple of Justice and the Sex Crime Unit at the Ministry of Justice.
Most of the improvement in our laws, the gender ministry law, the health laws, and all of those things have been because of the support of UNFPA, providing technical support.
Years of advocacy engagement by UNFPA and other partners is yielding some positive results as traditional leaders have committed themselves to ensure that girls are given a chance to education without any form of obstruction in the name of tradition and culture. Reflecting on the opportunities and challenges in delivering a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled, for the past 50 years, UNFPA believes there's much work to look forward to.
Our actions toward the 3 zeros of ending unmet need for family planning, to ending preventable maternal death, and zero gender-based violence will be grounded in quality population data and evidence.